Welcome to our Paulo Freire Center in back of the yards, a community we have served for more than 100 years, and welcome to Chicago Commons. For those of you who are new to Chicago Commons, I will give you an abbreviated version of our work. We are one of Chicagoland's longest standing social service agencies. We are proud to have empowered countless families throughout our 127-year history. We currently serve more than 4,000 individuals every year through three core initiatives: high-quality early education, from children's birth to 5, compassionate care for older adults and adults with disabilities through in-home care and center-based services, and socioeconomic supports for adult caregivers of our children and seniors through our Family Hub. We are excited to have you all here today because we pride ourselves on the high-quality impact of our early childhood programs. Here at the Paulo Freire Center and others like it, our children guide their own learning as they routinely exceed widely held, recognized learning expectations across various educational domains. From the Reggio Emilia-inspired pedagogy to the child-centered design of our facilities, we aim to inspire curiosity and wonder to help children grow. Later this morning, you will hear from one of our parents, Ms. Carolina Torres, who will share a few words on how we are able to impact families like hers. Now, our ability to impact families is made possible through great public and private partnerships with forward-thinking leaders like Governor Jb Pritzker, who recognize the importance of critical investments in children and families, especially those in neighborhoods like back of the yards. And Governor, during this pandemic, you did not back down on this commitment. You doubled down, then tripled down, and we thank you for it. Through grants and initiatives like the ones you are sharing today, you are allowing early childhood providers like us to maintain capacity and operate high-quality care and programming for our youngest children at a time when they need it the most. We thank you and look forward to the opportunities on the horizon. It gives me immense pleasure to introduce and welcome our Governor, Jb Pritzker.
Well, thank you very much to Edgar and to everyone here at Chicago Commons for welcoming us, for hosting us today. And you're not just hosting me, of course, you're hosting the Illinois Department of Human Services Secretary Grace Ho and DHS Early Childhood Division Director Kristen Chernowski, Senator Robert Peters, who's been a real leader in Springfield on these issues, and Representative LaShawn Ford, who I understand may join us in a few minutes. I also want to thank Carolina Torres, a parent here at Chicago Commons. It's sometimes difficult to be asked to stand up not just in front of a group of people, but in front of the press to share your story, but we are very grateful that you're here to do just that. It's no secret that it's been a mission of my governorship to provide quality childcare and early childhood education for every Illinois child. Even as we continue to fight an unprecedented global pandemic and nurture our economic recovery, I remain undaunted in that mission. The supports we're providing in Illinois for our child care ecosystem have been hailed as a national model throughout the pandemic. Today, we're taking a major new step forward in our quest to be the best state in the nation for families to raise young children. I'm proud to announce that starting today, licensed childcare homes and centers across Illinois will be able to apply for their share of a new round of relief, $300 million. That brings our total grant funding for childcare providers to over $1 billion since the pandemic began. To date, these relief grants have reached more than 5,000 providers, and crucially, 97% of 2020's recipients remain open for business today. Despite all the pains of the pandemic, they're still able to serve Illinois families. For working parents, that makes all the difference. Our newest round of grants will further support providers' ability to recruit and retain workers. Launching in February, these grants will focus on homes and centers that serve the 95,000 Illinois children whose families participate in our state's Child Care Assistance Program, CCAP. Supporting this sector is one of the best investments that we can make as a state. Working families need childcare. Businesses need workers. Today, we're making it more affordable for Illinois families, helping parents, especially mothers, go back to work, and bolstering providers' ability to have a full payroll of well-trained childcare workers. And as I announced in September, my administration is sending $100 million worth of bonuses out to the workers who work in our childcare facilities. Our childcare workforce is vital to the success of Illinois families and the Illinois economy, and we want to do everything in our power to support those families. Of course, our work to uplift this sector didn't just begin with the pandemic. That's why I began my term as governor by enacting the largest early childhood appropriations in the history of our state. We've also expanded eligibility so that even more families can benefit from our child care assistance program and access quality, affordable child care. A 25 percentage point increase in income eligibility since I came into office. That means that more people at moderate but higher income levels can get support for child care. We also continue to deliver payment rate increases to child care providers, and we're now in our fourth round of funding opportunities for that. By increasing the dollars that come through the doors, we're ensuring that help is going to where it is most needed, to the child care workers and to the early childhood educators who play such a critical role in the care of our children. I'm here today to tell you that we're not only providing help to parents and children and to the child care centers and the workforce that they rely upon, but this is really help for our state. We're making good on a pledge to turn Illinois into the best state in the nation for families who want to raise young children here. And with that, I'd like to turn it over to really an outstanding leader in our General Assembly, relatively new senator, although he and I have served almost exactly the same amount of time, and that's Senator Robert Peters. Senator?
Thank you, Governor. COVID has shown a true crisis, particularly when it comes to childcare. But Illinois continues to lead and to grow when it comes to investment and support. Our children and parents need this. Our providers need this to stay open and to provide services. Hundreds of millions of dollars of investment shows that we care and that we are here. We talk about public safety often, and I see this as an example of public safety for all. That we need to talk and focus on what it means to provide child care to our working class families, to provide investment to our working class families. When we talk about jobs and the economy, we are hearing from working class families over and over again that they need child care, that they need investment. When we talk about equity, stability, and fairness, we need to talk about child care. The fact that 97% of providers have been able to keep their doors open through COVID is an amazing accomplishment. And we must continue to stabilize the industry and fight to expand it. To all the families who are out there in need of help, we aren't here to use empty talking points or make bold statements without grounding. We are here to get things done. We will continue to fight so that you can live the best life that you deserve, so your children can get what they need during this period of global struggle, and so that we can continue to be the shining beacon of the Midwest. I'll just add that I live in a district where there are so many people going through so much pain economically when it comes to public safety. And the thing I hear often is that they want more support when it comes to childcare. The fact that we continue to make these investments, that Illinois, compared to so many states around us, continue to lead on this, is something that I say we should be proud of. Oftentimes when we talked about Illinois before this governor and before this General Assembly, it was used as a punching bag. But I look around us, whether it's Wisconsin or Indiana or Iowa or wherever, and I don't see what we have here in Illinois. This is an epic level of investment, an epic level of support, and I know that people are struggling, and sometimes it's hard to see, but we are here. We're here to help. Our offices are here to help, and we'll continue to be here to help, and we'll continue to fight for working class families. With that, someone who's been fighting for working class families, particularly on the west side, Representative LaShawn Ford.
Thank you, Senator. It's good to be here with the Governor and Secretary Ho and the Senator and everyone here. It's a great day when you can invest in the future. And that's what this is all about, investing in the future. So today, Secretary Ho, I want to congratulate you for being such a great listener to the CBOs and the people across the state that continued to fight during the Runner years where he destroyed childcare. And Governor, thanks for being a leader to bring it back, because childcare was destroyed in the state of Illinois, which means that families struggled, businesses struggled, and communities struggled because childcare was decimated. And so today is about making sure that young people have the ability to pull themselves out of poverty. Studies show that if you're born into poverty, you probably will remain in poverty. But one way to make sure that our young people in the state of Illinois has a way out of poverty is to make sure that they have great roots in their education. As a teacher by profession, you know the children that came from a early childhood development center that taught them the basic skills to be successful in K through 12. And you know those that were not. So I always compare it to the housing developers. There's no doubt that if you don't develop a house right, one day you're going to find out that the house has problems. It's the same thing with child care and development of a child. The child will continue to move on, but society will soon find out that we failed that child. So today, thank you, Governor, thank you, Secretary, for making sure that we give children in Illinois a fair shot at life. And with that, I think I get to bring a great listener and one that cares about her job, not just child care, but she's the Secretary of Human Services, and she takes it to heart. So thank you, Secretary Ho, for being who you are, and it's my job to introduce you.
Good morning. Thank you, Representative Ford, for all the work that you do in partnership with us. I'm so proud to be a part of Governor Pritzker's team as we announce today yet another investment in Illinois working families. Our early childhood system and community child care centers like Chicago Commons has been a critical system to support families throughout the pandemic and beyond. Thank you, Edgar, to you and your leadership team for welcoming us here today and for your partnership and service. Our early childhood team, led by our director, Kirsten Chernowski, has worked tirelessly over the past 3 years to first, as has been mentioned, to rebuild the child care system that had been decimated by the previous administration, then went on to protect and support that system during the COVID-19 health emergency. Fueled by state and federal resources and policy changes, we have ensured our early childhood infrastructure has remained sound. This $300 million Strengthen and Grow Child Care investment we are announcing today is part of a robust array of supports and was designed to prioritize equitable and stable funding across our state, focusing on those hardest hit by the pandemic to ensure that funding needed to improve child care quality and to support child care workers and the workforce. To help recruit and retain excellent staff, at least 50% of these funds will be invested in new personnel and workforce initiatives with a focus on increasing compensation and benefits. In addition to these Strengthen and Grow grants, the Department of Human Services wants to ensure that all child care providers are supported. So there is going to be an additional 6-month extension to our child care restoration grants, which have provided financial assistance to child care programs experiencing hardship since the beginning of the pandemic. These stabilization investments have allowed for increased rates for providers, reduced the financial burden of child care for parents, and have created innovative, workable policies that support families and providers through the ever-evolving conditions of COVID-19. At the Department of Human Services, we are honored to help carry out the governor's vision, which puts families and, most importantly, our children at the center of our recovery. Governor Pritzker has provided nation-leading support for the strongest investments in early childhood programs in Illinois. We will continue to innovate and to listen as we ensure support for all Illinois communities. Quality care and education is something that every single child deserves. It is a proven asset in our future, and it is an investment in working families. It is now my really great honor to introduce one of the people who live in this community, who lead in our community, Carolina Torres, whose son Antonio is currently enrolled here at Chicago Commons. Carolina is participating in Commons Pathways for Parents program, while she also attends city colleges to become a preschool teacher. Carolina, thank you for your commitment to early childhood education and for being here with us today. Thank you.
Buenos dias. Good morning, everyone. My name is Carolina Torres. I am the proud mother of 3 Chicago Commons students, 2 graduates, and 1 who is currently enrolled at Paulo Freire Family Center in back of the yards. Chicago Commons has been a blessing for us and the many families it supports. I first came to Chicago Commons about 3 years ago when I moved into the community. I faced a lot of challenges, but despite this, I knew I needed to enroll my children in early education. One day, I visited the center and met Ms. Chantella Turner, a family worker at the center, and she gave me a tour. The children looked so happy. I saw artwork on the walls and pictures of kids working with clay. I thought to myself, this has to be a private school. I mean, the only time I got to work with clay was a pottery class in high school. Before I could even ask how to enroll my daughter, Chantella was ready to help me. My kids thrived at Chicago Commons, and even at home during the pandemic, when everything was remote, here, my kids learned to write, understand math concepts. Chicago Commons has been one of the best things that happened to us. Like everyone, we struggled during the pandemic. Chicago Commons was able to help us with all the basic needs, like diapers, wipes, food, rent, and help with utilities, and more. Keeping these centers open means hope and opportunities for parents like me, and building a strong foundation for lifelong learning for my kids. Because my children are in a safe and loving environment, I am now enrolled in a program run by Chicago Commons and city colleges to get my associate's degree, bachelor's degree, and eventually become a preschool teacher. I just started in the spring. It's hard. Kudos to all the educators out there. With everything else, there are moments when I want to put it on pause. When that happens, I think of my children and the message I am sending to them by staying in school. When we're together, I'm always asking them questions and getting them to think. One of my daughters already tells me, "Mommy, you speak like a teacher more than a mom." And Governor, I want to thank you for what you're doing today and what you have done throughout the pandemic for the organizations of Chicago Commons and the thousands of families in Illinois. We need to keep these centers open. For me, it's personal because I look forward to coming back and working at a place like this when I graduate. Thank you. I would like to welcome back our governor.
Thank you. Terrific. Just terrific. Thank you very much, Carolina. Happy to take any questions from members of the media. Marianne.
Yes, I have a question that was given to me actually and it's not necessarily about this money, but someone who is trying desperately to help with other COVID services, who says there's a backlog. While the American Rescue Plan has given lots of money to the state, has been unable to access it, and believes that departments like Human Services, not to pick on you today, I'm sorry, but this is part of the question, that you're not getting that money out fast enough to those who are applying. The proposals are taking too long. You've got a new name for it. They're called NOFO or something. It's gonna take till next spring. What's going on in getting the American Rescue money out to the services that really work with people?
Actually, we are one of the fastest states at getting money out the door. I think you saw us recognized for that with regard to rental assistance and utility assistance. One of the best states at doing that. I'd like to know, at least whoever's asking the question, if there's a specific service they're referring to that they're having trouble with, but we certainly want to make sure that we're getting the support to people as fast as possible. A NOFO, so you understand, is a grant process to make sure that the organization that's seeking the grant is a valid organization that has.
The staff to get that going, according to the
Look, we have staff that does that. There's no doubt about it. I would say across state government as across private sector industry. There is a challenge in the labor market. We have many jobs that are available people are not applying for. One of the reasons that we're investing in early childhood education and childcare is so that we can make sure that working mothers, working fathers who may need childcare are able to get it so they can get back into the workforce, because that's one of the 2 or 3 things that are keeping people from jumping back into a job that's available. But you've seen the help wanted signs all over the state. It's also true in state government. We have help wanted signs in a variety of positions. But we have applied many people to this process of getting the dollars out the door. And again, we've been recognized for the speed of doing that, specifically in the rental assistance category.
I think there's some disagreement, but we'll have to move on.
I'm sure there are people who disagree. It seems to be a political year that's coming up. So.
Yes, exactly. And let's talk about the Omicron variant.
Yeah.
What are you thinking? What are your concerns?
Well, I think there's a lot that needs to be discovered still, and we're waiting for the CDC, the WHO, and research that's being done across the world. I think it's being done as quickly as possible. I know everybody wants answers as fast as possible. Most especially, how fast is it spread? Is the infection causing a deeper infection and therefore sickness that's harder to treat, let's say. But what we do know is that the increase in hospitalizations that we've seen, and again, we don't know yet whether Omicron is in Illinois. We know it's in the United States, so it's probably in the state of Illinois already. And again, we're testing for that. But what we've seen is that hospitalizations are going up, and there hasn't been a worse level of sickness anyway so far among those hospitalizations. It's just mostly unvaccinated people, and so it's unclear, is Omicron attacking people who are unvaccinated more often than they are vaccinated people? I believe that's the case, because that seems to be the case with everything else about this disease, but we'll have to see.
And so Mass, as the president today, is going to likely extend Mass through March. That is something that you favor as well?
Well, we have an indoor mask requirement in the state of Illinois, and so we're not lifting that now, especially not now. I've said all along that when I want to lift it is when we start to see hospitalizations really plunge. We've not seen that. It's going up, in fact, every day.
The governor of New York has postponed elective surgeries. Is that something you're considering here?
That's a peculiar problem to New York. As you know, when they implemented their requirement that healthcare workers get vaccinated, many healthcare workers in New York decided that they would no longer work. And so they've had a reduction of staffed beds even before Omicron came along. And so I think Omicron just added to the concern of the healthcare community. to be clear, here in Illinois, I consult with hospital leaders frequently to determine, what's the situation in your hospital? Do you have enough beds? What do you think will happen if we continue to have an increase? What are your plans? We're always watching that to know, is there something more we need to do? But I don't have it on my list right now. But every day, something new has come about in this disease. But right now, we don't think that we're going to have to do anything like what New York did. That's a problem peculiar to New York.
So if the numbers continue to go up like they have, and you've got this variant out there, will you consider more restrictions?
Look, I know you ask that question every time the numbers go, in the wrong direction.
Threshold, so if it hits the threshold in certain regions, will you enact?
I've always said that what we're watching are hospitalizations and the seriousness of illness as well. That's people going into the hospitals, and then overall capacity in hospitals. That's generally what we're watching. There are other indicators that you're always keeping track of, but that's what we're likely to look at.
And are you considering at all opening any type of mass vaccination sites for boosters, since there is certainly a small percentage of people that have gotten boosters so far?
Boosters are available widely across the state. We have a map that shows where they're available, and they're really, fairly widely available. But we, of course, would consider it if we thought that there was an area of the state where there's a massive number of unvaccinated people who seek to be vaccinated and can't seem to get them. The shortage of vaccine, though, that existed, last spring or in late winter is no longer a case in Illinois.
It's not an issue, but it is hard to get appointments for boosters. Now that if they're opening up to 18, now they're going to consider 16 to 17. Some people are waiting, go on CVS or Walgreens,
Yeah.
and they're waiting for 3 or 4 weeks to get a booster.
Don't disagree with you, and of course about those particular pharmacies, by the way, because the federal government supplies those pharmacies, and so we're talking regularly both with those large pharmacy companies and with the federal government to make sure that the supply is readily available. And so, yeah, when you all of a sudden are running up against a limit of what they've been receiving, we want to see them shipped more, and so we've expressed that to the federal government as well.
I'm not sure it's about supply. I think it's about manpower to administer boosters. So because of that, and the federal government is saying, because of this new variant,
Yeah.
run to get your booster, don't walk to get it, should the state open up more sites so people can get a booster quicker?
We obviously, the state doesn't provide workforce to those large pharmacies, but we do help with our local public health departments and their personnel. And so we're helping wherever we can. And of course, we always have available the National Guard to help us out. And they really were tremendous, as you know, in the first round of, the limited supply. But we really don't have a major limitation on supply right now. Yes, it's taking a little longer. You'd like to be able to do it today or tomorrow, and it might take a couple of days to get a booster. But again, we don't have a shortage in the state.
We have time for one more question.
I have a question.
All right, one and one.
Is the federal government flying illegal immigrants to Illinois for resettlement, like it's been reported they're doing in other states, and what's your view on that?
No, I'm unaware of illegal immigrants being flown by the federal government.
This week you were at the Hideout, there was a comment you made that when you're out of town, sometimes you have to say you're the governor of Chicago. Could your rivals have kind of hopped on that to say, see, he doesn't really represent the entire state? Would you like to?
Apparently, they don't have much to complain about, so it was a joke. I was pointing out, though, that people know the great global city of Chicago and the name of Chicago everywhere in the world. They may be less frequently aware of what state Chicago is in. You couldn't tell me, I couldn't tell you what county Glasgow is in, but people know Glasgow. So I was just pointing out that sometimes when people wondered where Illinois was, it was easiest just to say, Chicago.
Thank you.
Yep. Thanks.